Hey everyone, I am Dr. Steve Hruby. I am the head chiropractor here at Kaizen Progressive Health, and I want to do this little video today to tell you a little bit about back pain. I've got 20 plus years in the Valley working with people, and one of the most common things that we see is people come in with back pain. Over 80% of the population at some point in their career, maybe in your career, is going to miss work for one simple reason, and that is because of low back pain. Now, when people come in with low back pain, there's actually quite a bit of different things that may be going on. So I wanted to tell you a little bit about the different types of back pain that I look for as a chiropractor, and the different ways that we're going to treat this different type of back pain. Probably the most common type of back pain that we see here is mechanical low back pain. And mechanical low back pain is something you might get from lifting something wrong. We see this a lot in people who sit a lot at work. So maybe you have a job where you're sitting in front of a computer all day, and then you go home and you pick up your child or you pick up a box, and all of a sudden you get that grabbing your back, and that is more often than not mechanical low back pain. And very often what's going on with mechanical low back pain is there is an imbalance in the musculature in your back, and when you go do some type of activity that shouldn't be that stressful to your body, like lift up your child or lift up a box, all of a sudden you end up with low back pain. And these are things that we are going to assess, and we can usually find through a test that we do call an SEMG, surface electromyogram, which is going to directly measure these muscles in your low back, and we can see and we can show you where those imbalances are. And chiropractic adjustments are usually very great for helping get that pressure off the nerve so you start feeling better and you start healing properly. But what's very important, what many chiropractors don't do, is then you want to rebalance the musculature out so you just don't keep on recreating the problem for yourself over and over again. Now, another type of back pain that we see very commonly, you've probably heard of, is low back pain that is called sciatica. Sciatica can come in two forms, typically in terms of how it presents itself. There can be sciatica where you're just feeling, and let me explain what sciatica is. Sciatica is shooting pain down your leg. So what happens in sciatica is the nerves have been aggravated enough in your low back, or sometimes in your glute area, that you're going to start getting pain shooting down your leg. You might get it down one leg, you might get it down both legs. Often, but not always, with sciatica, you're also going to have associated low back pain. Sciatica is a pretty common issue. Again, there is very specific testing that we're going to do that's going to determine if you have sciatica. SEMG being one of them, because it's going to show directly where you have interference and what nerves specifically are being affected. We're also going to want to do x-ray so we can see structurally what's going on. Often with sciatica, in x-rays you're going to see progression of arthritic changes, decay and degeneration, and it's very easy to see that in an x-ray. Sometimes with sciatica, if we're not seeing results or it's something that you had for a long time, we may want to do an MRI, which will tell us even more specifically what's going on and how we're going to best treat your sciatica. But here's the great thing. More often than not, a very high percentage of the time, we are able to alleviate people's sciatica completely. And just like mechanical low back pain, when you're getting over sciatica, what becomes very important once you feel better is then you want to strengthen and restabilize so you just don't recreate that issue for yourself over and over again. Now, another type of back pain that we often are treating that really sciatica falls in this category too is radiculopathy, radicular back pain. And radicular means, or radiculopathy means, there's some type of shooting nerve pain going on. So sciatica is radicular pain, but there are other nerves in your low back that can get interference that is going to cause what's called radicular low back pain. As we age, and it's not because you age, but as we age, most people experience more and more decay and degeneration, which again is something that we're going to see on your x-rays. And as you get more decay and degeneration, you're more prone to these radicular type of problems. Now, I do want to say something about sciatica and radicular pain. That is, because they're almost always associated with decay and degeneration, arthritic changes, Not only is it important that you want to get out of pain and treat the problem, but you also want to address your arthritic changes themselves. And what happens, just like tooth decay, if you ignore, neglect it, and you don't do the things to maintain a healthy spine or healthy joints, you're going to end up just getting more and more decay and degeneration, which makes you more and more prone to these types of problems. So one thing that is always important to us, and I would say unique about us compared to your typical chiropractic office, is we're also going to give our clients the tools not only to get better with the problem they're having immediately, but also to help prevent further decay and degeneration, arthritic changes, so you're not turning into that little old lady or little old man with the hump in your back one day. So I hope that helps describe a little bit better the types of back pain that you may be experiencing. There are actually a number of different categories of back pain. Those cover like the big major ones that we see here. But we're very equipped with the technology that we have here to find out specifically what's going on with your low back pain, help you get out of that low back pain, and I think even more importantly, prevent further problems down the road for you and your loved ones. So I hope that was helpful and look forward to talking to you soon. Bye, friends.